alcohol addict and his family go through. And so when I read these lines that today there is irrefutable scientific evidence about the hazardous consequences of alcohol and tobacco, and yet there are no signs of its use decreasing in near future, I was really distressed. Why? And thinking about it, of course there are many answers to this question, but one answer I got was that we were exclusively focused on how to make a person stop it, but the emphasis on prevention was very minimal. So the current situation is that the alcohol and tobacco companies are employing the most famous film stars and cricketers to give misleading messages and tempt lakhs of new youngsters to start to drink. Being an addictive substance, 10 to 15% of them get trapped in it. A very small proportion of it ever agree to come to a de-addiction center, and a small proportion of that succeed in quitting. Are we ever able to solve the problem this way? I don't think so. Prevention is better than cure is true for anything, and more so for an addictive substance like alcohol or tobacco. So if we want a big change, then we will have to focus on preventive strategies. Now, when we think of preventive strategies, the first thing which comes to our mind is let's spread awareness. So, would awareness help? So the first question which people say is, people already know that alcohol is bad. Would it really make a difference to tell them it's so bad? To answer this question, let's see the findings of a survey we had done in a batch of first year MBBS students. When they were asked which are the following diseases or events which are common ways in which alcohol causes deaths, they just had to tick it. The options were given to them. 90% of them did tick liver cirrhosis, but ischemic heart disease, suicide and cancer were ticked only by 20 to 30%. Around 10% of them felt that alcohol drinking is not harmful so far as the person has good willpower, and around 45% felt that it is only slightly harmful, but it is okay to drink occasionally. Around 40% MBBS students felt that generally only people with some vulnerabilities will get addicted to it, rest of it can safely enjoy. And around 22% had a belief that for those who are completely abstinent from alcohol, for them also, it is advisable to start drinking in moderation to decrease the chances of getting ischemic heart disease. Now I have specifically quoted the example of MBBS students because the brightest students go to a MBBS college. And I have been to 42 medical colleges till now and many more other schools and colleges, and my observation is that the awareness level are similar everywhere. So, which means that our education system is definitely not being able to give the right knowledge and perspective on this important thing. Secondly, there are a lot of misconceptions. Thoda daru is good for the heart. Masculinity becomes more. It's a good way to decrease your stress. So, a lot of misconceptions also contribute why people think it's safe. And thirdly, as Professor Devin had said, that the industry has succeeded in brainwashing us into believing that responsible drinking is the way out. And therefore, even well-educated people believe that so far as I drink in control, there is nothing wrong in drinking. I have heard a talk by an anti-tobacco activist doctor, and while he was delivering the talk, he was sipping beer while he was delivering the talk. So what I want to say is, the knowledge and attitude with alcohol are as bad as they were with tobacco 40 years back. And so definitely awareness is required in this part. The second question is, why I feel awareness will really work is because there is a very strong body of evidence generated which can have a huge impact. For example, 3 years back when I read things, I didn't know that 33 lakh deaths every year are caused just by alcohol, which is 7.6% of all global male deaths, one death every 10 seconds. Did you know 22% murders and 22% suicides are attributable to alcohol according to WHO? Tobacco alone was responsible for 16% of the male premature deaths. It's the single most common cause of preventable premature deaths throughout the world. 30% of cancer deaths, according to a 20-year-long longitudinal study by American Cancer Society, 30% deaths of cancer are just because of tobacco. The premature heart attacks which occur before the age of 44, 50% of them, half are because of tobacco. According to the global burden of disease study in the young age group of 15 to 49 years, the most common risk factor for death and disability is alcohol. The second most common risk factor is tobacco. Now, to be frank, when I read all this, I was like shocked. Shit, man, is this so bad? Now, if we are able to take this data to youngsters, are they fools to hit the axe on their own leg? But the problem is no one is doing this job of convincing them that this is the axe. All this data is lying in the medical journals and WHO manuals. We need to bridge the gap and take this to the youngsters at the right age, and I'm quite sure they are smarter than us. Thirdly, so what does evidence say? Does awareness campaign work? There is quite robust evidence, at least in the context of tobacco and cannabis. To quote one study done by NGO Hriday, it was a multicentric study done in Delhi and Chennai. So after the intervention they had done in multiple schools, they found over a period of 2 years that in the control schools the tobacco use increased by 68%, whereas in the intervention school it decreased by 17%. The intention to smoke increased by 5, decreased by 11. And intention to chew tobacco decreased in control schools also, but it decreased much more in the intervention schools. Regarding cannabis, in the USA there is a very long-term study being done called as Monitoring the Future project. So in that they saw that among the school students, the reduction in the cannabis use between 1979 and 1991 and then the increase in 1990 after 1992 corroborated very well with their beliefs about the risks of cannabis, and which was because of the focus on education campaigns in the school as well as in the general media. Now about alcohol, the evidence is not so strong. At least I have not come across any study which says that an awareness campaign gave big results. So as we were told yesterday that the most cost-effective ways which have been seen to decrease the alcohol-related harm are the legal ways. So what are the implications of this study? It does mean that if the ease of availability, marketing, social norms don't change, no matter how much education we alone do, will not make a difference. For an effective control of this problem, all 5 things have to go together. Thus, education, the addiction programs, community participation and change in social norms, as well as promotion of constructive recreational activities. Now a lot of this has happened in the context of tobacco together, and therefore tobacco control successful results we are seeing. So does this mean awareness should not be done? No, awareness is a prerequisite which will create the social and political will for the legislative measures to come. So that is definitely required. And one more thing which I feel is the implication of this is effective education campaigns in alcohol, the way they have been done for tobacco, have not occurred. So we also need to reflect on how can we improve the effectiveness of what we are teaching the students. I also feel that as Sir said, we are till today we were protected because of our culture of abstinence. But now the industry is trying to break that. It has recognized as an untapped market, and let us accept that the religious and cultural influences are decreasing. So unless we give students hard facts which they can believe on, they are going to get swayed by the marketing, and we are going to lose our culture of abstinence, and then the situation will be very difficult to reverse. And hence I believe we are at a very critical phase in the cultural history of our country, wherein all of us need to give priority to spreading awareness on this particular topic. So what's the best way to do it? What is the best age? Being the addictive substance, once they start taking it, then if you tell them, it all falls on deaf ears. We will have to go before the age of first contact. And as we saw, now the age of first contact has decreased to 13.5. Therefore, we need to start going in standard 7, standard 8, and I was really impressed that in Thailand they are teaching kindergarten teachers to also talk on it, because yes, somewhere our long-term beliefs get formed at that impressionable age. So we need to start early. Is school medium the best way? I guess it's the only possible way, because that's the only way we can reach to the millions of people, youngsters in rural, remote and underprivileged areas without having to spend the money. Alcohol industry has a lot of money. They do TV ads, posters, and they can reach out to even tribal villages. But the only way we can do it is through school curriculum. Also, nowadays exam marks is the most important thing to a student. So in the exams, if questions on this topic start coming, people from towns will open WHO websites and learn more of it than what we all know. So I think putting it in the school curriculum will really work, and it's the right age. Also, there was one point made, will they listen or not? So I have made around 270 talks till now, and I just wish to tell you, I have had not even one negative experience. Students welcome this information wholeheartedly, and their response has been so enthusiastic that what I had started just for 6 months, I have continued for 5 years. And the main reason is the students love it and they give a very enthusiastic feedback. If we say properly, they do listen. So what should be the components of a good awareness module is beyond the scope of the talk. But based on the feedbacks I have got from students and what I have read briefly, I just want to say that what we should talk on is the research evidence generated about the premature deaths. We should talk about how it impairs the quality of life even while they are still alive. We should talk about importance of not touching the first smoke or the first drink, because it's an addictive substance and quitting it is very difficult. The most common question asked is, if I only drink occasionally in parties, is that fine? So I think this question needs to be answered in the curriculum. We need to answer misconceptions which are common about alcohol and heart, about stress that alcohol doesn't decrease the stress, it just creates an illusion of the stress decreasing, and in the long term it becomes the cause of your stress. Masculinity, it decreases your financial power, sexual power, physical power, attractiveness, job capacity. It decreases your masculinity and does not increase it. Advertisements are a very important reason why people start. So we need to give youngsters a perspective on what it is. We need to tell them that the court has banned it, but still some selfish celebrities for money's sake are doing surrogate ads, and we should not get fooled by them. While we talk of ads, pan masala is the thing which is advertised now. So we need to talk on that also, that why it is harmful to take that. We need to teach kids how to resist the peer pressure. We need to also talk of how they can shape the peer pressure in the school, because the senior batch decides what will be the peer pressure. To give a very short example, I had met a patient of cannabis, and then I talked to him that why did you start it? He had cannabis-induced psychosis, so his life had gone majorly wrong because of it. So I asked, why did you start? He said after joining an engineering college for 2 years, he didn't take it, but his room partners were taking it, and so in the 3rd year he started it. Means definitely he was a person who knew this is bad, but because of the peer pressure he took it. And then he said that in his college there were 2 buildings. So in one building people took cannabis, and in one building they took cannabis and brown sugar also. So I asked, why did you choose only cannabis? So he says, no, in my building, my seniors told that cannabis is fine, brown sugar is bad. So I didn't take. In the other building, seniors themselves took, so they say it's your choice, whatever you want to do. So I realized it was by sheer luck that he was in building 1 and so he's taking cannabis. If he was in building 2, he would have taken both the things. Point I want to make is, students have a very huge power to shape the peer pressure. And if the education module has a lot on it, then it will help the peer pressure shaping in that thing. We need to denormalize its use. And one critic is, education campaign is one time. I give a one-time talk. But Shah Rukh Khan is daily telling him drink. Dhoni is daily telling him drink. So can we compare that aggressive marketing with a one-time thing? Probably no. So we need to make sure revision is also taking place, active learning is also taking place. How can we do that? So few possible ways are, after we have given them the data, we can 6 monthly or 1 yearly, we can keep debate competitions, poster competitions, essay competitions. So to prepare for this, they are going to prepare actively on it. That is going to really push it in their long-term memory. One more way can be the industry has the money to give ads, put banners, but we have the schools to put the banners. So the posters which summarize the key messages in a pictorial way, if we keep them on the wall, then every day the student comes to the class, just glances here and there, he is revising what alcohol and tobacco is doing to him. So I think a pictorial poster on the wall can be a very good way. Posters which they have made in the competition, that can also be put up on the wall. Role play on how to resist peer pressure can also be done. So to summarize, alcohol and tobacco are addictions which are a huge public health problem today. Awareness about them is poor, and building that awareness would be the first step to the way ahead. And strengthening the school curriculum is a very effective way to reach millions of children and empower them with adequate knowledge about alcohol and tobacco so that they can resist the rising peer pressure. We should keep in mind that if 1 or 2 youngsters do it, we can say it's their fault, they have become bad. But if it becomes a trend, it's the fault of the society, which failed to educate its youth at the right age about what these addictive poisons actually are. Let us collectively accept this responsibility. Jai. So I just wanted to share that if some of you would like to see the content which I discuss with students, you can drop a mail to me on this ID. And this website, we have put up most of the content which I say. And because nowadays students are on WhatsApp and Facebook, we are trying to make posters which summarize the key findings of good studies, which can be shared on WhatsApp and Facebook. So